In the evolving landscape of healthcare, one question looms large. Could artificial intelligence render doctors obsolete? Join us as we embark on a journey through the frontiers of medical innovation, where the future of healthcare hangs in the balance. Today, we stand at the precipice of a monumental shift, a convergence of technology and healthcare that promises to reshape the very fabric of medicine. Artificial intelligence, once confined to the realm of science fiction, now stands poised to revolutionize diagnosis, treatment, and patient care. But amidst the promise of unprecedented advancements, a fundamental question arises. What will become of the healers we've long entrusted with our well-being? Can the art of medicine coexist with the relentless march of AI? Join us as we navigate this complex terrain, exploring the opportunities, challenges, and ethical implications of AI in healthcare. As we peer into the corridors of modern healthcare, we confront a myriad of challenges: a shortage of medical professionals, diagnostic errors, and disparities in access to care. These issues underscore the urgent need for innovation, for solutions that can bridge the gap between demand and supply, between expectation and reality. Consider the global shortage of doctors, a problem exacerbated by aging populations and increasing healthcare demands. Patients wait weeks, even months, for appointments, while others lack access to care altogether. Meanwhile, diagnostic errors persist, leading to unnecessary treatments, prolonged suffering, and in some cases, tragic outcomes. It's a sobering reality that demands our attention, our ingenuity, and our resolve. But amidst these challenges lies an opportunity, the opportunity to harness the power of artificial intelligence to augment and amplify the capabilities of our healthcare workforce, to enhance diagnostic accuracy, improve patient outcomes, and expand access to care for all. However, this journey is not without its obstacles. Ethical considerations, data privacy concerns, and the risk of widening healthcare disparities looms large. As we traverse this intricate landscape, vigilance is key to ensuring broad distribution of AI benefits and prioritizing patient well-being. AI holds the promise of making healthcare a fundamental human right rather than a mere privilege. Enter the realm of AI in healthcare, where algorithms analyze medical data with unparalleled speed and precision, where diagnostic accuracy reaches new heights, and where personalized treatment plans are no longer a distant dream. The applications of AI in healthcare are vast and diverse. From predictive analytics that forecast disease outbreaks to virtual health assistants that provide personalized care recommendations, AI is transforming every aspect of the healthcare journey. Consider the field of medical imaging, where AI-powered algorithms can interpret radiological images with astonishing accuracy, aiding radiologists in the diagnosing of many conditions and neurological disorders. Furthermore, AI-driven robotics are revolutionizing surgical procedures, enabling surgeons to perform complex operations with enhanced precision and reduced recovery times. In addition to diagnosis and treatment, AI is also reshaping healthcare delivery and administration. Virtual health assistants streamline patient interactions, while predictive analytics optimize resource allocation and healthcare workflows. The potential of AI to improve healthcare outcomes and enhance patient experiences is undeniable. However, as we harness the power of AI, we must remain mindful of the ethical considerations and challenges that accompany its implementation. Ensuring data privacy, mitigating bias in algorithms, and maintaining the human element in patient care are paramount. As we navigate this transformative journey, our medical pioneers must strive to leverage the full potential of AI while upholding the values of compassion, empathy, and patient-centered care. Consider for a moment a groundbreaking study published in Nature Medicine that showcased the immense potential of AI in revolutionizing medical diagnosis. In this study, an AI system surpassed human doctors in accurately diagnosing diseases from medical images. The implications of this achievement are profound, signaling a paradigm shift in the way we approach healthcare. Imagine a world where patients receive faster, more accurate diagnoses, leading to earlier interventions and improved outcomes. This study is just one example of how AI is outperforming human doctors in certain tasks, raising compelling questions about the future of medical practice. Are we on the brink of an era where machines surpass human expertise in diagnosing and treating diseases? Can we trust AI to make decisions that impact patient care, or do we risk sacrificing the human touch that defines medicine? As we grapple with these questions, it's essential to approach AI in healthcare with caution and foresight, ensuring that technology serves as a complement rather than a replacement for human expertise. Nevertheless, this breakthrough serves as a testament to the transformative potential of AI, offering hope for a future where healthcare is more efficient, accessible, and effective than ever before. In closing, let us reflect on the dual nature of artificial intelligence in healthcare, a tool of immense potential, capable of revolutionizing patient care, yet fraught with ethical dilemmas and uncertainties. Whether AI ultimately replaces doctors or simply augments their capabilities remains to be seen, and time will without a doubt answer that question for us all. So, as we chart a course into the future, let us not lose sight of the guiding principles that underpin the practice of medicine: compassion, empathy, and the unwavering commitment to the well-being of our fellow human beings. For in the end, it is not the technology itself that defines us, but how we choose to wield it in service of humanity. What are your thoughts on the future of healthcare in the age of AI? Will AI replace doctors? Share your perspectives in the comments section below.